Hi, I'm Dr. Hardesty, a board-certified plastic surgeon practicing here in Riverside, California. Today's topic is access incisions for placement of the implants. Unfortunately, we cannot do surgery or do a breast augmentation without making an incision to place the implant. Today we're going to talk about the 4 incisions and the pros and the cons of each of them. One incision is the periareolar, which is around the nipple. Number 2 is the inframammary, or the breast crease incision. Number 3 is the axillary, or the armpit. And number 4 is the umbilicus, or the belly button incision. Okay, periareolar. What's the positive? The incision blends with the nipple. It's also a nice incision to make if we're contemplating possibly doing a mastopexy or breast lift, because all breast lifts start with an incision around the nipple. It also blends in with the nipple. For instance, if I have some exotic dancers, they will go ahead and take an eyebrow pencil and put that right over the incision, the little white line, and that incision then becomes invisible. The negative is we're limited by the length of the incision. Now, it's not a problem with normal saline implants because they go in deflated. Silicone or gel implants come from the factory pre-sealed. Therefore, we're limited by the size of the areola, thus the size of the incision. The inframammary, the most popular. Why? It has the lowest rate of capsular contracture. Capsular contracture is when the scar tissue forms around the implant and distorts it. The positive is that we can place any size implant through that incision because we can lengthen that. The incision is placed approximately a ½ inch to 3/4 of an inch above the fold. So if you're wearing a bathing suit or laying back, if the bathing suit creeps up, you won't see that incision. Standing forward, you won't see that incision. We laughingly say the only people that see that incision are dogs and your lover. The negative is there's a small scar on the breast. The next incision, axillary. Positive, no scars on the breast. Negative, we're again limited by the incision length of the axilla to put a large implant in. A normal saline implant, it's not a problem. The other negative is if you ever needed a revision, let's say a lift, or you had to have surgery for a capsular contracture, very difficult to do it through the armpit or axillary incision. It also has a slightly higher chance of capsular contracture. The fourth, the umbilicus. That's where we make an incision around the umbilicus. The positive is there's no scars on the breast. The negative is you can only use saline-filled implants because we have to put a tube up the skin and then go under each breast. The negative is you cannot use silicone breast implants because the tube is not big enough to push the tube on through. Another negative is sometimes this incision is quite large around the umbilicus and that can be visible. Another negative is revisions. If you ever needed a revision, like the armpit, you can't do it through those incisions, or if you need a lift. In conclusion, there's 4 types of incisions. One is the periareolar around the nipple. Number 2 is in the crease. Number 3 is in the armpit, and lastly around the umbilicus. Each of the incisions have their positives and negatives. We offer a full anti-scarring program to prevent scarring, and then we have more lasers than any office in the Riverside area to treat scars should they appear. Thus, like in the choice of the breast implant, the size, the shape, the location, the incisions is just one of the choices to be made with you and your doctor. Thank you for your attention, and I hope to see you soon.